Good afternoon, and thank you for the opportunity to speak on this important matter. I'm the Vice President of the East Greenwich Town Council. You've heard from our President and Councilman Engelhardt about this and our attorneys. I'd like to note that we hired Goldberg, Zorno and Associates to issue our written comment in conjunction with New England Institute of Technology, which, as you probably know, houses a very large number of students directly across the street. They have a grave concern here and have joined us in the submission that we provided. Our residents have a lot of concern, as does the council, with this project. We're going to have, trucks driving through our neighborhoods with body parts, viruses, and pathogens. And we're going to have the risk that these viruses and pathogens will be released through accident, through improper operation of the facility, poor design. This is unproven technology. And it's also important to note that the applicant has absolutely zero demonstrated experience running any medical waste facility, let alone this particular type of equipment, which is experimental. It is so experimental that it's not actually an operation anywhere in the U.S. Used on medical waste. I don't know if they searched the country to find the one state agency that would allow their residents to become the guinea pig for this kind of an operation, but they landed here, and that's what's happening. It's not a listed technology, and so the director of DEM is required to make an initial determination. This is an alternative technology, which is supposed to, according to the director's letter, they're going to do in 2 steps. There is no 2-step process in the law. That determination is a threshold determination. It's not a determination made after you allow them to build it and then we see if it works. You could obviously pilot test like we do with other equipment, and that simply isn't the way that the DEM is elected to go with this. In addition, it violates all the statutory and regulatory opportunities for public participation, because if indeed a threshold determination were made, the public could appeal it, participate, etc. The way it's currently constituted, if it's a conditional approval, and then only subsequent to the issuance of the permit, the applicant submits testing information and protocols, the public has no further role at that point. And how would we ever know about the determination that the director is making, whether it's sound and meets the requirements of an approvable alternative technology? I believe that violates the Administrative Procedures Act, and the director must make that determination now. There are conditions listed in the NOI that are post-issuance. One is the surrogate virus testing protocol. There's no reason the applicant couldn't have submitted that protocol in advance of this public hearing so that the public could vet it. The way it's currently constituted, both that protocol and the West Warwick Fire District contingency plans are mere submissions that only the DEM sees, not the public. Since the surrogate testing protocol is critical to determine whether the pathogens escape or whether they are totally destroyed as required in the air permit, it's critical we know that up front. And I note that Mark Denon at a public information meeting said that he could design a protocol that would basically make the equipment pass or fail. And so the public, even if DEM doesn't have that experience, we do. We can hire it, and we should have the opportunity to participate. Excuse me, just had your timer just totally blotted the, okay, here we go. So what we're asking here is that DEM deny the permit without prejudice to allow the applicant to reapply after the DEM first makes a ruling as to whether or not this is approvable alternative technology, which is required to be done under the Administrative Procedures Act. The applicant can resubmit. And alternatively, you can continue it for that purpose. East Greenwich, I would ask, should have an opportunity for our fire department to have a contingency plan review as well. We're first responders who are actually closer than West Warwick. If you choose to proceed, we ask that you deny the permit because The applicant clearly has not made the demonstrations required as an alternative technology, in that it's not protective with respect to total impact on the environment, which is a finding noted as number 2 in the director's letter, nor can it ensure that the health, safety, and welfare of both facility employees and the general public will be protected. That's condition 4 that must be found. I submit that the record clearly demonstrate that the applicant has not met these burdens. Thank you.